Are there vaccines out there that some adults are surprised or shocked to know that maybe they should also be immunized, not necessarily just for the flu shot? Are there other vaccines out there that maybe adults should explore?
Well, there are a couple. If you are over 60 or over, you should probably get the shingles vaccine. Shingles in elderly people is not a fun thing to have. Rarely it can cause blindness, but more often it just is a very painful condition that can last even for years. Older adults should also get a pneumococcal vaccine. Adults that have some underlying health problems may get some special vaccines earlier. Certainly adults should get the DTaP vaccine if they've not had a tetanus shot, certainly within the last 10 years, or if they're going to be around any younger children, they need to get it even if they've had a tetanus shot within 2 years.
The misconception, you don't need a tetanus shot until you get bit by a dog.
That's
not.
You might need a rabies shot in that case, but
yeah, that's true.
But tetanus usually, as Dr. Brennan mentioned, every 10 years throughout life is recommended to have your tetanus shot up to date. But certainly there is some evidence that shows after a period of 5 years, if you do have some type of injury, or if you are traveling maybe abroad and you could be injured during that trip, you might want to talk to your physician about updating that tetanus shot maybe a little bit early if it's been at least 5 years since your previous dose.
And now, in addition to the plain TD, we have, as Dr. Brennan mentioned, we have the Tdap, and that, if you have small children and infants that are not fully protected against the pertussis, or whooping cough, if they don't finish that series till about 12 months of age. So we talk about, it's almost like cocooning. If the infant is not totally immunized, then what you can do is vaccinate the parents, the grandparents, the babysitter, the older siblings if they're eligible to get the Tdap vaccine. So hopefully if they are vaccinated, then those close family members will not then be exposed and bring that disease back home to the baby. So it's not only beneficial for the individual, but for those small children or immunocompromised family members that they might have that cannot be vaccinated.
Babies who get whooping cough, 75% of the time it's from mom, dad,
Yes.
siblings, or grandparents.
Mm-hmm.
Wow.
And it's a high percentage of fatality with an infant that develops pertussis.
But an adult whooping cough can just be a bad cough. Maybe it's
Right.
going to last for a long time, but it just starts off as a little cold, and that's when you're contagious. You don't even know you have it. And even if you went to your doctor, they're not going to figure out you have it.
Mm-hmm.
Okay.